All right, so give me the answer that I'm looking for.
What is the answer that you're looking for, Nate?
What do you think about non-Christian therapy?
Oh, okay. What do I think about it?
Give me the actual answer, not the some of them are really good. Give me the what are the bad ones doing answer.
Okay. All right. So like, what are the bad ones doing?
Non-Christians going to bad non-Christian therapists.
Right.
What's happening?
Man.
Tell me. Do it.
Okay. All right. Okay. You're right. I do sit here and say that some are good and I do have an issue with how quickly therapists diagnose individuals.
Okay.
Again, I'm not saying all therapists do this. I'm just saying that there are some that you can go in and one day they're diagnosing you with something. And that may or may not be true. And I think that takes time. But I guess the issue that I've got with therapists probably at large is diagnosing kids or children too quickly. That's an issue for me. So for example, you got a hyperactive kid.
Mm-hmm.
It is easy to label that child as having ADHD.
Yep.
But if you label that child,
there's a word for every behavior in therapy now.
Yes. And I guess that's what I'm getting.
And a medicine for it.
And I guess that's what I'm getting to is that there is like, we are so quick to label people that don't fit within a specific box.
And you think non-Christian therapists are doing this more than Christian therapists?
Oh, that's a good question. I don't know if they're doing it. I would sit here and go, man, I hope Christian therapists aren't doing this as much, but it probably is happening as well.
Okay.
Just how quickly they're doing it. That would be a great question to ask individuals that run in both circles. They have an overlap. That'd be a great question to ask someone.
Do you know someone else I could talk to?
Yeah, absolutely. I do.
Well, I want to talk to him.
Okay. Yeah, absolutely.
Okay. Because this is a thing that is all these topics that we're doing.
Right.
Man, I really hate it. Oh, this is just, this is the worst of life to me.
I know. And okay, why is it the worst of life to you? I want to hear what you guys say.
Do I have to? Okay. I just think most of it's BS.
Okay.
And I think exactly what you just said, that people are like, that's why I said I want to do the thing where I go see how fast I can get on anxiety medicine, because I feel like I could do it in 5 minutes and I'd be out of there with a prescription. And I think that's with a diagnosis and a prescription. And I think that's fucked up. Honestly, I think that's really stupid.
Yeah. And I agree.
Like that.
Yes.
And I don't understand, like all the conspiracy theories about big pharma trying to make people crazy and make people think they're crazy. Mm-hmm. It feels like the therapy industry is the industry that is convincing people they're crazy when they're not, to sell drugs and to sell their own services. And it feels like it's so easy for these people to do that instead of be one of the good ones, that more of them go that direction for money instead of be good ones. And that's why I don't like the industry as a whole.
Yeah.
And maybe that's a little bit conspiratorial, but I don't think it is. I think that's human nature to go toward the easy, evil option instead of the good, hard one, and be an outed person in your circles of therapists and counselors, and try to do things the right way. And that's why I would never go to one. I will never go to therapy, because I don't know what I'm getting into, and I'm not about to spend hundreds of dollars on some person that's just trying to get me on drugs as quickly as possible and keep me around for as long as possible and never fix my problems. Right. I'd rather just sit here and try to put up with them or deal with it myself.
Yeah. And I would 100% agree with everything you're just saying.
Okay.
In the sense that I agree with you. Like, that's what I'm saying. Like, that's why I kept, because there is a need for therapy. Like there are people that genuinely need therapists.
Like the one thing that you said last week about whatever you said last week, when I agree with you, like that.
That thing.
Yeah, that.
Yeah, I think there are
like people with like actually, yes, like people who actually went through a trauma.
Right.
But the problem is, if you actually went through a trauma and you go try to see a therapist, you don't know if they're going to tell you that you need to feel terrible about that forever. And here's drugs, stay on these drugs forever. Right. You're always going to be like this. You're always going to need these drugs.
Correct.
And that's the risk you run by going to therapy.
Yeah, it is. And that's why I also say that for me, I have counselors that I recommend that I know won't do that.
Right.
Right. And I will say this though, I also know Christian counselors that like there's not an end goal in sight for them. In other words, if you start therapy with them, they just want to keep you coming.
Right.
I do know that happens. And so, but for me, the best counselors are what you're talking about. They're like, all right, we want to help you. Mm-hmm. We do not want to be your therapist forever.
Right.
Right. We don't want you to keep coming in here. Because to me, if you're having to keep coming to that therapist is not doing their job well.
Right. But for me to get to the point where I figure out that they either don't want me there forever or want me there forever is 10 sessions later. And I've already spent $5,000.
Well, not 5,000.
Do you know what I'm saying?
Yeah. But yeah, I mean, and I say that, but I mean, you literally, if you did 10 sessions, depending on who you were seeing, you're spending between 500 to 1,000.
Yes.
You are spending that much. And, you know, depending on what your insurance
so
covers
I've
or not.
that much money.
Or not covers.
And now I'm like, oh, they're probably just going to keep me here forever.
Yeah. And that is a risk you run. I'm not going to lie. And
I'm sorry to say it, but there's dumber people in this world out there than me that are getting roped into it.
And I don't 100%.
Right?
100%. And no, so I don't disagree with you on that.
This is my problem with everything. This is
all the therapy.
With
I
all
get
of
it. And see, and it's so hard because because I do counseling.
Yes.
I do have to recommend people to therapists. Like I know how badly therapists are needed. I know that for a fact. Like the things that I hear would probably blow some people's minds. Mm-hmm. And there are therapists that are absolutely needed because they are trained to be able to help people, whether it's walk through trauma, whether it's walk through grief or undealt with grief, or abuse, anxieties, depressions, all that stuff. There's legitimate cause for therapists and need for therapists. But I do hear what you're saying because there does seem to be like an organizational racket, if you will, in the therapy world where it is come to us. And I will say this too, not just come to us, we can give you money or get your money. I do think the same way that clients can become codependent on their therapist, because it happens, where clients become codependent on their therapist.
Right.
Therapists can also become codependent on their clients.
Right, and that's like the deepest form of it. Like,
right, and
like you can't live without me anymore.
Yeah, and it's a huge savior complex, right?
Yes.
And so in the best situations, you as a counselor, this is kind of crazy, but listen to this. Like the best situation, and some states require this, you as a counselor, you must go see another counselor at least once a month, share with them what's going on in your practice, and hopefully that person can objectively tell you, like, I hear you. See, it may be time to let this person go, right? Hopefully they will catch on to some of those things and call you on it.
It's just a lot of work people have to do, therapists have to do in order to be good ones. And it's so easy to be a terrible one.
Yeah, I don't. Well, it is. It is easy to be a quote unquote terrible one, especially when meds get involved.
Yes.
And so therefore that therapist is needed to continue to. They have to, they have to refill those meds. Therefore, those patients have to see them for them to get refills and right? And so it can become this cycle. But again, that's why I get conflicted, right?
Yeah.
Because I've seen the horror.
I do not.
I know, but I've seen like the horror of it, like where kids are labeled at a really early age with having, this disorder or whatever. And lo and behold, they went through adolescence and puberty.
Right.
And guess what?
They're fine.
They're fine. Right. They never needed it to begin with.
Mm-hmm.
And I guess most extreme cases we're seeing nowadays.
And what are these things doing to their brain development?
And I think that's a huge thing, right? And that's part of like psychologists are supposed to be studying that, right? What are the meds doing to impact the development of children's brains? And I don't know, one, if we're being honest with the findings, and then two, if we even have a long enough runway of that yet on some of these meds. And so,
just so I'm a moron. This is just what I think. Okay.
Okay.
This is just my opinion on this on all this stuff. You can have, don't get mad at me. I'm just stating an opinion.
I get you.
You know what I'm saying?
Yeah.
I don't usually give my opinion on the show.
I know.
And so, but I hate this. I hate this so much.
I know.
I think all this is just such crap.
I know. I know you do. And I guess, and that's where, like, for me, it's like, but I have seen the benefits of it, right?
Yes. Witnessed
it firsthand with people in their lives. And so I know the need of good counseling and good therapists. And I think maybe it would be intriguing.
But I think about it in terms of, if all of it went away, would society be better off or worse? And that's how I think about it.
Yeah.
Because if the whole industry disappeared and there was no such thing as a counselor or a therapist or whatever,
right,
and you did that with friends and people you trust and talk to them about your stuff, and there was, you know what I mean? I just
I think
unless.
So here's the thing. I think we went from a culture. Yeah, obviously they didn't have like counselors or psychologists or therapists, but then nothing was ever dealt with. Right.
Right.
Mental health disorders and issues were never diagnosed that were real.
Right. And we were giving people lobotomies who sneezed too often.
Right. So we went crazy on that end because we didn't understand psychological behaviors and emotional and mental states. Right.
Right.
And so
that's the state of nothing.
Right. That's the state of nothingness. And, so for me, being a family and child development major, for me, it was all about the development, right? The cognitive, physical developments of individuals with, in relating to one another and in relating to society as a whole. And so I'm glad. That's what I was saying. Like we don't want to go back here.
Right.
But it's almost like we've gone probably too far.
Way too far.
To where everyone needs to go see a counselor. And that's not the case, right? Every child needs to go see a counselor if they have the slightest, what we think is a developmental issue.
That's the other.
Why? When reality is they don't. They're kids. Let's see what it looks like on the other side of puberty, right?
Mm-hmm. Right.
And I will say, to me, this is like the worst state of therapy is and here, me being honest, when we get into issues of therapists diagnosing and working with kids that maybe genuinely struggle with gender confusion, or maybe it's just a passing phase.
Right.
But yet they're going to label them and diagnose them and, oh, you're trans or you're right.
Yes.
And all that stuff. Like, no, like, what are we doing? No, we do not need to be giving puberty blockers to kids, right? We do not need to be giving them medicines to help them transition. We do not need to mutilate their bodies. Let's let them get to the other side.
You said it.
I did it. I did. I got no problem saying it.
We're all the way here now. I feel like it's my fault.
Let's get to the other side of puberty and let's see where they're at, right? Because so much of this within a child is normal, and especially now. In other words, I say normal, like it's within a child to be like, well, I don't feel comfortable in my own body. Of course, a lot of kids don't feel comfortable in their own bodies growing up, right?
Right. And for lots of different reasons.
Correct. And so it's not. I just think we are overreacting. and we're
because they just got
overdiagnosing.
here.
Yeah,
And they just got their body.
right. Yeah, and they're trying to
Maybe
figure
they
it
don't
out.
know they don't know what it's doing.
Right.
Like
Yeah. And
stupid.
right. And I'll hear that, well, but you have no idea the mental, trauma and the development of breast and Well, you know what? What's worse than that? Cutting them off.
Yeah.
And then realizing later on, oh, why the hell did I do that?
Right.
Well, because my counselor told me to.
Maybe we've
You talk about
known
you talk about the
how
trauma
that goes for billions of years.
Right. Well, and you're
And no one's had a problem.
I mean, you know the amount of therapy those kids are going to need?
Yes, and drugs and medical treatments and surgeries.
Correct.
And that's the farthest end of the conspiracy theory.
Correct.
On all of this
On
crap.
all of it. Yeah, and so
Because it's the most.
Yes, that's to me that's what I was saying. That's the absolute worst part of it all.
They get the most money out of one person as possible doing all this stuff to kids.
100% they do.
Ever.
Yeah. And that child will be trapped with them.
Yeah.
Or a counselor or a therapist, for, like you said, forever. You know?
And on drugs and in and out of hospitals and
yes.
can't do anything else with their life except try to stay alive.
Well, and and I do think, unfortunately, this is what we've created, right? And so this is what you're talking about. This is the extreme, horrible side of therapy.
Yes.
And what it's become. And so I agree that the nothingness was not good, but I also agree with you that the extreme side is definitely not good.
I think this is worse.
Oh, I do too. I will say that I do too.
Okay.
I think this is worse.
So we need to go back to nothing. No more therapy or drugs.
Yeah, I just think, man,
get over your shit.
Right. Well, it's like, yeah, I mean, the cat's out of the bag now.
I'm half joking.
I know you are. But like the cat's out of the bag now. Like we got to deal.
Yeah.
And it's like with everything else, it's like, you look at even like medical doctors, right? Like our healthcare. Like we need reform, right? We don't want to scrap the whole system, but we need a reform.
Yeah.
And it's the same thing, I think, within psychotherapy. Like it needs reform. Mm-hmm. Unfortunately, I think oftentimes we're the psychotherapist, the psychologist, psychiatrist are pushing this further extreme,
Yep.
and wanting to diagnose every little single thing, and I'll say this too, because when you're getting your doctorate, you have to offer something new to the field. Okay. So like when you're doing your dissertation, you have to offer something new to the field.
Why?
It's part of dissertation work, okay? And so if you think about that, and we've been doing psychology the way we've been doing it since the 20th century going forward, like you got to keep producing new things.
So you just come up with some new crazy.
I'm just saying. And it's like the crazy what was crazy 50 years ago is no longer deemed as crazy, right?
Right.
It's like we keep pushing that envelope of what is deemed, a disorder, or what is deemed not sane, or what is deemed not healthy. And we go off on all this stuff, and in the midst of it, I'm like, but I don't want people to lose me on this, because some people are in therapy, they're listening to our podcast, and they're getting so much help. And I've said this before, like I see a therapist once a month. And it is for me to be able to go and to dump and to be able to process the things that I hear. Mm-hmm. But then also this therapist was huge for me when I was going through my pancreatitis and my own physical illnesses. She helped our marriage in the midst of that. And not that we were having major marriage issues, but the caretaker or the caregiver, Melanie, my wife, she and I mean, it's hard when you're giving care to someone for 4 years with a chronic illness. And that's what she was having to do. Mm-hmm. And then I, through the loss of my dad and helping me grieve through it. So man, I am indebted to a therapist that I see on a regular basis. And I think she's just
how much did they charge?
Best therapist in the world. So how much do they charge? It's if worth,
you're in debt to them.
Well, you know what I mean. So I'm grateful I know you're just kidding. I know.
We probably need to end this one pretty soon. What are we at? 55?
Yeah.
All right, one more thing I got to say.
Okay.
This is another one that makes me mad.
Oh, Lord.
Okay, so every time, this kind of goes with the question too.
Okay.
Every time I've people have told me I should get therapy before.
Okay.
And to me, it always seems like they don't like my opinion on something.
Okay.
So they want someone who's a professional to tell me the professional opinion I'm supposed to have on war in the Middle East or some crap. You know what I mean? And there's that whole thing, emotional intelligence, which is basically, it seems like a buzzword to be okay with trans people.
Okay.
You know what I'm saying?
Yeah.
And it's like, it feels like all of this therapy is designed to change my opinion or worldview on something. And that's when people tell me I need therapy.
I got you.
As if my opinion on something is a mental disorder.
Right.
Like, what is happening with that?
Yeah. I mean, none of that's okay. You know, the idea of like emotional intelligence, right?
Yeah.
Has actually been around for a while.
Okay.
And you're right. That's maybe the form it's taken now, is to go to this extreme place, because that's apparently what we do. You know, emotional intelligence before was just how empathetic, right? Are you to people, right? How much ability do you have what is your ability to emotionally be able to connect and relate with other people?
Well, for me, it's 0.
Right. And here's what I'm getting to, is individuals can have a low emotional intelligence. It doesn't mean that they need therapy.
Okay.
Okay. Like, I think my emotional, and not I think, but even through tests and assessments, like my emotional intelligence is pretty high. Well, that bodes well for me as a pastor.
Yeah.
Okay. Not everyone needs to have the emotional intelligence that I have in their jobs and in their life, right? And so I don't think that should be a gauge, a barometer of if I need therapy or not. And we definitely shouldn't start saying, well, you're ignorant, go see a therapist. I think that's incredibly dangerous.
Have you ever seen that happening?
I haven't.
Okay.
I haven't had anyone ever say to me, my opinion is this, it differs from other people, they're telling me to go see a therapist, or should I go see a therapist? I haven't.
Okay.
Not until right now.
All right.
Yeah.
Well, it's not like people flat out say anything.
Right.
But the way they talk about it, it's like, I have an opinion on something, and they're like, well, you need to see a therapist because because the therapist will definitely sit there and make you change your opinion, and since you're stupid and the therapist went to school for it,
right?
Yeah, you should listen to them and change your opinion.
Yeah, I agree.
And also, here's drugs and pay me for it.
I know, and we don't need all that stuff. And this is what I would say too. So, as a Christian, so
that's why I was asking you, because I feel like that's happened to me the other way, like with non-Christians telling me to have non-Christian opinions.
Right.
And go see a therapist and get your non-Christian opinions. So when I'm asking you, why would you send a non-Christian to Christian therapy? And it seems like the same thing. Okay. Yeah. And I don't like that. Even though.
That's fine.
Well, I don't like any of it, but.
Yeah.
But yeah.
And I think for some people, they don't need therapy. They don't need counseling. I do think that individuals, just through basic discipleship, meeting, talking, discussing scripture, and discussing the heart of the Lord and praying together through a long process, there can be so much transformation in that, right? Okay. So I think really healthy discipleship actually addresses some things that may come up in counseling, if you want to put it that way.